crisis. Safety of learners in schools and learning facilities, as well as learning inequalities and protection concerns, must be addressed when schools reopen. Thus, this resource. Before we begin, I'd like to acknowledge the organizations that have come together to plan for this event. ASBE, the Asia South Pacific Association for Basic and Adult Education, Plan International, Save the Children, World Vision, Norwegian Refugee Council, and UNICEF, and in coordination with UNESCO and the Asia Pacific Coalition on School Safety. Apart from the speakers who will be introduced to you all later, I am joined by colleagues from UNICEF Regional Office of South Asia, Mr. Frank Van Capel and Ms. June Lee, also Mr. Nia Trin from Plan International. And now to welcome us all and kick off the webinar, may I call on Mr. Andrew Baker, the Regional Director of South Asia, China, and Indonesia from Plan International, to share the opening remark on behalf of APCSS. Andrew, over to you.
Thank you very much, Rachel, and thanks, June. Good afternoon, good morning, everybody. Thank you for joining the launch today, and thank you very much for inviting me to give these opening words. Let me start by reminding us all of the backdrop to this guide. As we're all aware, the Asia-Pacific region is the most disaster-prone region in the world, and those disasters worsen the already existing vulnerabilities and create setbacks in achieving the Sustainable Development Goals. It's thus critical to support children's rights to dignity and protection before, during, and after disasters, conflicts, and indeed in the ongoing climate crisis. And of course, it was in response to that situation that the Asia-Pacific Coalition for School Safety was established back in 2012 by a group of INGOs and UN agencies. And that organization works to create a space at the regional level for discussion and sharing of technical resources, of good practices, of lessons learned, and of model policies on safe schools to minimize the impacts of disasters to children's education and to coordinate and promote advocacy for comprehensive school safety. Now, of course, on top of the context of an already disaster-prone region, we have the global COVID-19 pandemic, and that's led to unprecedented levels of disruption to education. Even before the COVID-19 crisis, South Asia had a chronic education crisis with 95 million children of school age not in school. And with COVID-19, and in particular the responses to it, the vast majority of schools in the region have been closed, and more than 430 million children have had to rely on forms of remote learning, which of course have been very patchy in their provision and have only partially been able to fill the gap. And in particular, they failed to serve children who haven't had access to things such as the internet. And of course, that includes the poorest and most vulnerable children in the region. So although COVID-19's impact on the region's school children has been mitigated in the short term by some creative approaches to term breaks and exams, countries across South Asia urgently need to develop plans for education in this new era of COVID-19. And as governments prepare to reopen schools and other learning institutions, ministries and school communities need to minimize the risk of transmission of COVID-19 within those learning spaces and address the learning inequalities and protection concerns that COVID-19 has exacerbated during the school closures, and in particular for girls and other marginalized groups. So in that context, I'm very pleased to be part of the launch of the Safe Back to School Guide for Practitioners, which builds on the UN framework for reopening schools and gives concrete actions that can be taken at the community and school levels to operationalize these global policy recommendations. The Safe Back to School Guide for Practitioners is an interagency resource. It was written in a practitioner-friendly way, and it suggests specific activities across the sectors of education, protection, WASH, health, and nutrition. And within the scope of this webinar, we want to introduce this guide to a range of different stakeholders across the region share some examples of good practices and lessons learned on school opening, and share some examples of how some countries in the region have so far used the guide in their COVID-19 responses. An inclusive participatory process can help to bring all children and young people into school and leave no one behind. Let's continue to make sure that we're able to make millions of children and youth, especially girls, part of our commitments and plans for building resilience across the Asia-Pacific region. Let me finish by thanking all of those who've been part of the development of this guide, and of course those who've organised the meeting today. Thank you.
Thank you so much, Andy, for this very insightful background and context to the Safe Back to School Guide. My name is Frank van Capella. I'm an education specialist and education and emergencies focal point in the UNICEF Regional Office for South Asia. I will be moderating the two upcoming discussions, but for now, it's my pleasure to introduce the two speakers for the next presentation, Jim Akkers and Mame Omar Diop, from the respective UNICEF and UNESCO South Asia regional offices. So they will be giving an overview of the regional context in South Asia, of school reopening, the impact of COVID-19 in the education sector, and also briefly give an overview of resources developed for COVID-19 at regional level, which are linked to the Safe Back to School Practitioners Guide. The first speaker is Jim Akkers. He is the Regional Education Advisor for UNICEF South Asia, covering 8 countries in the region. He was previously on secondment to the UNESCO International Institute for for Educational Planning in Paris, where he was head of training and education programs. He has also been the regional education advisor for the East Asia and the Pacific region, as well as the Eastern and Southern Africa region. And prior to that was the UNICEF Chief of Education in several country offices. And the second speaker is Mame Omar Diop, Head of Education Sector in the UNESCO New Delhi Cluster Office, which covers 6 countries in the region. Prior to joining the New Delhi office, Omar was the Senior Program Coordinator of the UNESCO International Institute for Capacity Building in Africa, and he previously worked at UNESCO HQ in Paris. Please feel free to use the chat at any time for any questions, and over to you, Jim.
Okay, many thanks, and my apologies for having my video on right from the beginning, but I get a very unfortunate background, so I have to get that one sorted out. So I didn't want to come back on with an unfortunate background. And my thanks to Andy for not only using one slide, because I am feeling slightly guilty that we're using 14 slides and there's a lot of information that we'll be sharing, but we only have 10 minutes, so we're breaking the rules on this. So essentially, to compensate for that, we're going to go pretty quickly and gloss the information on the slides. But we thought it's quite good to have a lot of information there for those who'd like to read the slides later, so that they're self-explanatory. So I'll kick off, and then Omar Diop, my colleague from UNESCO India, will be taking the middle slides, and I'll come back at the end. So if you can go to the first slide, please. The first slide essentially is on the global situation in terms of school closure. And as we're all aware, in most countries in the world have actually closed schools. Some are starting to reopen schools now, but generally we're still in a very bad situation where we're trying to entice children back to school and to encourage governments and their families to allow their children to return to schools. And that's why this document that we're launching today is so important in terms of promoting people's confidence about going back to school. Next slide, please. So we're sometimes asked about what is the impact on learning of schools being closed. Well, I think what this slide demonstrates essentially is that if the closure is only for a short space of time, generally the impact will not be huge. In fact, there may even be some lessons learned. There may be some valuable things that have happened as a consequence of closures, such as parents engaging more in education, and children might say exams being delayed as well. But essentially, it's a kind of disruption that you can handle, and it often happens due to natural disasters, etc. The problem is when the closure becomes more long-term, of course, the impact starts to increase. So the obvious thing is that you get more dropout. There are already lots of dropouts in the region, as Andy was saying, even before COVID, especially for the more marginalized and vulnerable groups. And then the second problem is that maybe in cases where, you know, the alternative learning modalities that have developed during school closures, some of them have actually been very promising, but of course they vary in quality. And the more elite children get, the better quality they get into internet learning, etc. So one of the problems as well is when the schools return, if they return in a patchy way, that can also increase inequalities within a country. Some children from some provinces may return much sooner than others. And then, of course, you know, there's the crisis had a big impact on financing, at the household level and at the state level. So that's very, very worrying. ECD has been neglected, I think, because some of the alternative modes of learning, they've reached parents, but children need face-to-face at that age. And for adolescents, things have become worse than they were even before. And then, of course, there are all the other risks of schools being closed, such as immunization, disruption, nutrition, etc., and the impact on early marriage, mental health. A lot of other impacts beyond the education sector. Next slide, please. So this is essentially is the picture of school closures across the region. And as really, I'll just go down to the bottom of the slide there. The situation at the moment is that 5 countries, the closures are still nationwide, whereas in other countries, schools are being reopened, but often in a patchy way. It might be by phase, it might be by grade, and it might be with geographic differentiation. As I've already said, that can also be a problem in the longer term. Next slide, please. So, I mean, one interesting question is, why did schools actually close in the first place? Because if we look back at the crisis, there was absolutely no need for schools to be closed, for example, for 3 months in Nepal when the infection rate was virtually 0. And it's interesting that actually none of the major development ages ever advocated for the closure of schools. So why did schools close, and was it justified? Well, the epidemiological evidence is actually very mixed and evolving, and it's actually inconclusive from countries where schools have actually remained open. It does seem that there's a risk of infection. There's obviously a risk of infection to children, but the risk of death is very small. But perhaps one of the drivers of continued closure is the fear for infecting adults, which there is some reality behind that. And the Lancet in 2020 did say that reopening could lead to surges in infection. So there are concerns, there are real concerns about opening schools, but I'd like to hand over to Omar now to take the next few slides. Next slide, please. Omar? Okay. Omar, are you able to connect? If not, I'll just continue. Okay, Omar's having problems in connecting, so he did connect with his phone before. Sorry?
Jim, maybe I'll call him, but in the meantime, you go ahead.
Okay.
He has a problem with the connection.
Okay. So this slide shows the issue in terms of the closure of schools globally. Across the different sectors, across pre-primary, primary, lower secondary, and upper secondary, and essentially it shows that in the Asia Pacific region, that essentially most of the schools close across these different phases. Next slide, please. Now, one of the major concerns coming out recently about school closure has been simulations around what will the effect be in terms of loss of learning. I must say I have some mixed feelings about this kind of data that's coming out, because we don't want to also fuel another crisis, in another psychological crisis amongst parents. We don't want parents panicking and thinking the school's been closed for several months now, my child will never be able to catch up in terms of learning. But indeed, some of the simulations by the World Bank, and I think Rice was another one, is that the impact could actually be very significant. So if you look at the on the left-hand column there, that it could be a 25% increase from 40 to 50% in the share of lower secondary age children who are below the minimum level of proficiency. And there is even one study in Pakistan which looked at the impact of the earthquake in Pakistan, where it said that school closure for 3 months amounted to a loss of about a year in learning from the children affected by that crisis compared to other children in Pakistan. So clearly it could have a significant impact in terms of loss of learning. Next slide, please. One of the interesting things to look at in terms of the continuity of learning is what has been happening globally. So on the right there, you've got what's been happening globally. And then on the left, you've got what has been happening in South Asia. So for example, globally, there's been quite a lot of emphasis on adjusting the content of the curriculum, for example. So the obvious thing to do is, if your school year is going to be shorter, will be to adjust the curriculum content. So 61% of countries globally have done that, and in our region it's actually been 75%. Now this seems to be a very sensible thing to do. And then you've got the adjustment of the school calendar, which says 50% in our region and 67 globally. I would have thought everybody adjusted the school calendar. I need to further understand that. And then the big thing coming out of the World Bank reports as well is the real emphasis on remedial programs. So what happened, for example, after the earthquake in Pakistan was that I think the teachers thought the children had missed out on education for 3 months. Let's now rush through the rest of the curriculum and catch up with the rest of the country. And that is the last thing that you should do. The first thing you should do is you should assess the children, find out where they are, and then build up the foundations so that they can learn effectively. The last option here is also, it's an interesting one globally. It's only 22% are going for increasing classroom time, whereas in our region, countries are talking about 60% are talking about increasing classroom time. But of course, this puts a lot of stress on teachers, etc. Next slide, please. But the important thing about the previous slide is there are a lot of options that can be considered to try to cope with the loss of learning time. This slide essentially focuses on the impact on high stakes examinations and assessments. And of course, education systems are going to get quite messed up if children are not able to take their examinations at the end of the year, particularly if those examinations act as a filter in terms of what they do the next year. So there's been a number of responses around this. One is just the continuation, just doing it as intended. The other is staggering the examinations, so phasing them over time, postponing them, online examinations if you have the capacity to do that, but in our region that's not often the case, etc. So this slide really shows about how we're trying to react to this kind of issue. And in some countries, essentially, they've just they haven't taken the examinations. They've based progress on continuous assessment, which is probably quite a good strategy if you have that continuous assessment. Next slide, please. So the guidance that UNESCO and UNICEF and I think many other agencies have been given on school reopening, which I'm sure that this global cluster, this Safe Back to School, also relates to, is based on this a document which came out several months ago now, which was co-authored by UNICEF, UNESCO, World Bank, World Food Programme, and now UNHCR. And essentially, it looks at the opening of schools from six key dimensions. And one of them is on the safety aspect, which we'll be talking about a lot today in your launch. And another one is the learning, which I think I've just touched on now. And the third column, I think, is what we must be really concerned about is when schools reopen, are we going to be losing even more children? Is the number of out-of-school children going to expand? Or are we going to use it as an opportunity to make sure that all out-of-school children can be reabsorbed into the system through more creative ways of organizing education, etc.? And then on the right, you've got the well-being and protection angles as well, which are extremely important. And then cutting across these different pillars, you have also a finance and a policy aspect. Next slide, please. So we found this framework as very, very important. I think the other really important thing about the framework for reopening schools is that initially you ask people what should schools be doing to ensure a safe reopening, and you get so many different things that schools are expected to do and that teachers are expected to do, so many things that often it's not achievable. So the nice thing about the framework is it talks about what you should do prior to reopening, and then immediately after reopening, and then after that, where you're looking at things, for example, in the third column, you're looking at things like continuous professional development, training teachers in digital skills, etc. Things they can be looking at then, but they cannot be looking at when you immediately resume because there are so many other challenges. Next slide, please. So the whole issue about reopening schools is also really complex because we've had some discussions with colleagues about should we go for the minimum standards approach? But then, of course, the concept of minimum standards in a middle-income country may be very different to in a low-income country. So we've gone for more of an approach which really looks at people taking decisions based on the balance of what are the risks of not reopening schools compared to what are the risks of reopening schools, and how do you mitigate these risks? So there are two columns here. The one on the left looks at the different contexts within a country or the decentralized level of the country, and I don't have time to go into it now. And the one on the right looks at the education system itself and key variables such as classroom size, pupil-teacher ratio, etc. And these are all the factors which will eventually go into this kind of equation as to whether countries should reopen schools. And I think the key message here really, what we're seeing in terms of reopening school at the moment is all the different key actors have got to be on board. The government's got to be on board, the teachers have got to be on board, and the parents have got to be on board. Otherwise, you'll reopen schools and then they'll close again, as we're often seeing. Next slide, please. This really is just a quick synopsis of some of the products, the tools that we've also been developing in UNICEF Rosa around reopening schools. If people are interested in it, please contact us. One guidance note we've done is that it's actually looking at high population density areas such as informal slums, refugee camps and IDP centres, where it's much more difficult to open schools. So we can share that if people are interested. And the other thing is what June has been authoring, this Opening Up Better Schools Toolkit, which it's a very comprehensive guide. It's Excel based, and there are a lot of different tabs that you can look at for different aspects such as gender and disabilities, etc. So we'll be very pleased to share that. It has actually been used in Bhutan, India and the Maldives to help ministries with decision making on school reopening. Next slide, please. Okay, one of the big sort of issues that we're trying to promote, or opportunities that we're trying to promote in UNICEF, is that when we open schools again, it shouldn't be to the same, often suboptimal levels of education that were provided before. This is a very challenging thing to say because many countries will actually have less finance for education after COVID than before. But nevertheless, I feel it's important that we try to build back better and that we don't make this just a rhetorical statement. So I think, as Andy was saying, there was a lot of issues affecting education before COVID, such as out of school children, gender parity, learning crisis. And I think we have learnt a lot from the COVID response. One is that innovation can have such an exciting role to play. We can bring other partners in, the private sector, etc. We can start looking at learning as more of an autonomous activity, which it should be anyway, rather than whole class teaching. We can involve parents more, etc. So I think it is an opportunity, and there's several meetings coming up in the next few weeks, actually, one with Bangladesh next week, on trying to reimagine the future. So what might we want to see more of in future as a result of the lessons learned from COVID? And I think the first one is really something which is on the boiler anyway before COVID, is we need to be more inclusive in our approach to educational planning. Secondly, we need to really optimize the potential of ICT, but make sure it's with an equity focus. We've learned that learning can be more flexible in terms of space and time during COVID. Another very exciting opportunity, I believe, is that if children have the foundations already, there's no reason why secondary education has to be linked to a physical institution. It could become a public good. We're already saying that learning needs to be more relevant to skills, so more of a skills approach, more focus on continuous professional development and making sure teachers aren't left behind in ICT. Maybe moving from assessment for learning, moving towards assessment for learning from assessment of learning. Because before we were just simply establishing how many children couldn't learn. It's more important to work out why they can't learn and then do something about it. Maybe expanding the opportunity to involve parents more, etc. So that's essentially just a quick synopsis of what we feel in UNICEF and UNESCO might be a reimagined future for education once we get through this very debilitating crisis. Many thanks for your attention, and I'm sorry if I went on for too long there.
Thank you so much, Jim. Hi, everybody. This is June again. Thank you so much, Jim and Omar. I'm sorry you couldn't connect for this really great overview of what's happening in the South Asia region in terms of school closures and reopenings. The next part of this webinar will focus on introducing the Safe Back to School Guide, which is the main objective of this webinar. In this next segment, we will have 4 presenters who will take you through overall what this Back to School Practitioner's Guide entails, what is the objective of it, what are its main contexts, and also take you a little bit more deeper into the different aspects of it and how these different components can be used to guide school reopening and the discussions around school reopening. This second part will be a total of 40 minutes. 30 minutes of presentation and followed by a 10-minute Q&A. And before we begin, I would just like to introduce you to our 4 main speakers. First is Rachel. She is the Humanitarian Technical Advisor for Education at Save the Children International in the the Asia Regional Office. We also have Rosianto, who is the Humanitarian Technical Advisor for WASH at Save the Children. We also have Salome, who is the Senior Advisor for Education in Emergencies at World Vision. And lastly, we have Sarah, who is the Early Childhood Care and Development Advisor for Asia, Save the Children in Asia. So without much further ado, I will hand this over to you, Rachel.
Thank you, June. All right, can you please move to the next slide? Okay. So the Safe Back to School Guide aims to be a user-friendly, practitioner-focused tool that outlines the key steps needed for a coordinated, inclusive, all-hazards approach to school reopening and links to further guidance where needed. It's currently available in English, French, and Spanish, and translation is happening right now for Arabic, Portuguese, Italian, and Turkish. So I guess the question is, why this guide? We recognize that there are several other resources that have been developed to support school reopening in this pandemic. Our colleagues from UNICEF and UNESCO have mentioned and detailed some of them. The Safe Back to School Guide helps concretize the UN framework into actions that can be taken on the ground. And I think this was mentioned, it's also written in a practitioner-friendly way, and also has suggestions for specific activities across the sectors of education, protection, WASH, and health and nutrition. It also complements the resource UNESCO Supporting Teachers in Back-to-School Efforts, a toolkit for school leaders. The Safe Back-to-School resource is something that program and coordination teams, like most of us are, can pick up and run with, but also it's a great tool for collaboration and coordination with ministries and local authorities. And we refer to this resource as an interagency resource because technical experts from multiple sectors and many agencies have contributed to writing and the review of this guide. The organizations that have been involved in planning for this event are some of those organizations. And it is endorsed by both the Global Education Cluster and the Child Protection Area of Responsibility. And really having the endorsement of those two sectors further emphasize the importance of integration. Can we move to the next slide, please? All right. So the Safe Back to School Guide provides unique opportunities for integration, technical quality, and building back better. Why integration? Well, because right now, COVID-19 and the school reopening plans, it is a shared priority across programs, operations, technical, and even advocacy. COVID-19 has highlighted how truly interconnected all our sectors are, and this is an opportunity to work more efficiently and towards more impact for children if we work together. On technical quality, this guide has been written drawing upon our best practices, including from work in safe schools, in parenting without violence, in mental health psychosocial support, as well as our learnings from previous responses, such as the Ebola crisis. Now, by building on experience and evidence, we can make the COVID-19 back-to-school experience much smoother and safer for children around the world, and in this region in particular. And finally, this was also mentioned by Jim. This is an opportunity to build back better. COVID-19 surprised us. This is a chance to get the foundations right for the next emergency, be it a health pandemic or, like in our region, another hazard such as a cyclone or an outbreak of conflict. Next slide, please. Okay. Now, what are the contents of this resource? This 26-page document contains checklists and technical annexes. We have two kinds of checklists there. The first is the integrated Safe Back to School checklist for program staff. This is especially useful for project design and coordinated intersectoral planning, such as the adaptations to the humanitarian response plan, and also for monitoring and oversight. The next kind of checklist is the school-friendly Safe Back-to-School checklist. This is a two-pager. It provides top-line actions for a head teacher or school committee to use. And we have the technical annexes. And those are the titles of the technical annexes that are included in this resource. Now, the latest annex there is the Annex 7, or the Annex on Additional Considerations for Early Learning Programs. We will hear more about that later. The annexes basically provide detailed guidance and resources for specific activities that are mentioned in the checklist. Now, be aware that not all actions will be appropriate in all contexts, and we will need to contextualize them based on local practices and also align them with government standards. Next slide, please. Now, who should use this guide? Well, basically you, all of us here. This guide, as mentioned, it's for practitioners. It's for program teams, for coordination teams, advocacy teams. And we also can use it with partners. We're talking about coordination teams like the Child Protection Area of Responsibility, the Education Cluster, the EIE working groups, refugee education groups, or even the local education groups. We are encouraged to share this document and reference this guidance as coordinated school reopening strategies are developed and operationalized. Next, please. Okay. Now we have identified several principles for safe back to school. Those are number one. Those are all number one. So that means they're all very important. But kidding aside, the first there is integrated approach. Now, COVID-19 has a multifaceted impact on children's rights, like in education, protection, mental health, and schools, and more. Now, as schools prepare for reopening, it's important that a coordinated and integrated approach is applied. The next principle is the participation of children and youth. Now, children have a right to be heard in processes that impact them. Children's participation should be inclusive and accessible for all. And young people can play a key role in community mobilization and in dissemination of accurate information, especially on COVID-19. Third principle is on gender inclusion and accessibility. Children may face barriers or have different needs in returning to school because of their age or their gender, their ethnicity, their socioeconomic status, and all efforts during school reopening must be inclusive and accessible for all children. This is a unique opportunity to bring all children into school, and this includes returning students and even those who were already out of school before the pandemic. This resource also includes practical ways to be gender transformative in your approaches and interventions. The next principle is involving the whole school community. This principle means that we should engage the whole school community, which includes children, the caregivers, the teachers, even the local government, the community, and the administration in schools. It is an inclusive and accessible way at all stages, in an inclusive and accessible way in all stages of the school reopening process. The next principle is on building existing structures such as children's clubs, student councils, the PTAs, and the youth-led groups, or the child protection committees and family networks. School communities should capitalize on their existing capacities during the school reopening process. Finally, build back resilience. The school reopening process provides an opportunity to strengthen existing education, health, protection, and disaster preparedness systems, making them more accessible, inclusive, participatory, and protective. By applying the lessons we have learned from COVID-19, governments and whole school communities can better prepare themselves and reduce risks of future crises related to health, natural and everyday hazards, even violence and conflict. The next slide. Next, please. Okay, just to give you an idea, next slide, please. We're coming now to the checklist. This section is the integrated checklist, is 6 pages of checklist. It gives key actions for health, nutrition, WASH, M&E, education, and child protection sectors before and after schools reopen to ensure sectoral integration in the school reopening process, including steps to prepare for a second wave or another type of emergency that may cause school closures in the future. Next, please. Next slide. Now, this is just an example of what, can you go back to that slide, please? Previous slide. This is an example of the checklist. That was an example of a checklist for school, for health, nutrition, and WASH. And as you can see, this includes short actions and also links to operational curated resources, and those are the annexes. And we have actions for before and after schools reopen. Okay, now let's move on to the checklists. This is the first checklist on monitoring, evaluation, accountability, and learning. Um, Before schools reopen, there are certain activities that need to be done to ensure that the schools will be safe. And this includes assessing the readiness of schools, the teachers, the learners, even the cleaning staff, and the facilities, and the space to ensure that physical distancing can be observed as per the national guidelines. Now, after the schools have reopened, we can conduct needs and gender assessment using participatory methods to find out if children and young people were able to continue learning even while the schools were closed. And we can use that information to plan for any support they need upon their return to school. The accountability and feedback mechanisms will collect the feedback from learners and the teachers to get information on their experience during school closure and also inform planning for future school disruption. Okay, now I'll hand it over to my colleague, Anton, who is our regional WASH advisor, to discuss the health, nutrition, and WASH checklist. Over to you, Anton.
Thank you, Rachel. Hi, everyone. Good afternoon, good evening. I know we're running late, so try to complete this section on the WASH, health, nutrition, and WASH. So as Rachel mentioned about the checklist, before school reopen, and all schools should be clean, disinfected, including the feature of schools that are reserved for people with disabilities, such as handrail and ramps or knob doors. But the most important, if the school have been used as a treatment or is isolation center or the type of temporary health facility, which is we might see in it many. So it should have a more thorough disinfection process and as advised by local health official. The checklist also include a link, various WASH resource and then cleaning instruction to serve as a guide to user for this guide. The most important also referring, adapting to your local health authority. Also using this checklist also to engage with the community in cleaning and maintenance of school reopening. Everyone who involved, we need to get well-trained training on how they do cleaning and follow the protocol. So before the school reopen, they must be ensuring that school have adequate water supply for ensuring the toilet clean, hand washing station, including the soaps available all the time, and the teacher and learner are all staff in school trained to on correct school hygiene practice and disinfection. As everyone said, this is the new normal for us. I mean, we should adapting into the new situation. Also, if the essential school health service and a regular protocol should be in place, including stocking school with first aid kits, PPE, also refreshing training module for school personnel. That's very important. And after the school reopen, the cleaning and disinfection of facilities surrounding areas should be done on regular basis. This should be agreed with among the school, association, teachers, and all the key stakeholders, including the local government, the Minister of Education and District of Education, as well as maintaining the WASH facility and supplies. Learners will be educated on good hygiene. We want to making sure that the school, as always, as the resource of education, not become the source of infection. That's very important. I guess thank you for the opportunity, Rachel, including WASH in health and nutrition in this part, and also important for the improvement of due to the transformating of the virus, the changing the facility a little bit, upgrading like open window or use open air schooling if feasible, if the budget available, school canteen facility where the school providing cafeteria for lunch and snacks to be clean, and monitor absent and implementing measures to manage and prevent health risks. So there's also the last part of there's still also preparation for any future school closure in case of virus outbreaks. So the improving step, including sanitizing the school before close, and proportioning of some key water and sanitation supplies like disinfectant, all the basic hygiene essential consumable. Thank you, and over to you, Rachel.
Thanks, Anton. Sally?
Right. Thank you very much, Sally from World Vision. I'm going to highlight what the checklist covers in terms of education. Just to say that the guide can be used for all learning spaces, be they formal, non-formal, and early childhood development centers, temporary learning spaces. And we also have a link that can help you see how to adapt this particular guidance to camp settings. So I'll give some examples as I go through what needs to happen when schools are, before schools reopen. So the first thing is around preparation for physical distancing in, around, and on the way to schools. So here we're looking at a physical distancing in terms of guidance, especially staggering schedules, so that we have maybe reduced class sizes. We also have arrangements of the classrooms so that we have physical distancing. In some countries, the policies by the Ministry of Education may not stipulate this, but this guide allows us to even use the World Health Organization guidelines on this, which is 3 feet or 1 meter distance. Again, it's about reducing the contact time and looking at how children will not necessarily congregate around, you know, the access area into the school, like the gates, and having multiple entrances to avoid, you know, overcrowding. It's also about not sharing resources like school supplies like pencils, notebooks, and it's about having alternate activities where we don't have physical contact, so substitution of these so that there's open air activities. It's also around just ensuring that there's also development of age appropriate messages about, you know, what needs to be ensured when children are coming to school and being picked up from schools. The other important aspect is how to ensure that return to schooling captures the most vulnerable and prioritizes for them. I'll give examples. In some countries, we've seen that the children who are in examination classes are the ones being prioritized in the school reopening. In other cases, it could be, you know, just having access to children, for children who have really reduced opportunities to access learning remotely. So irrespective of what it is, we are being reminded to prioritize the most vulnerable. Again, it also gives us an opportunity to see how to strengthen linkages with community social protection mechanisms and ensure that the needs of the most vulnerable are actually met. So provision of kits where necessary. And before we open schools, we must remember that the children who went home due to school closure or the teachers are not in the same as they're coming back. So this creates a very important aspect on the whole element of personal well-being of the teachers, and there's a technical guidance specifically for that. Just looking again in terms of after schools reopen, what we need to do is a prioritization of psychosocial support and social-emotional learning. We must remember that, of course, routines have been affected. So just trying to get this on board and ensuring that as you read this and checklist or guide, then there is a technical guidance on mental health and psychosocial support, and it gives examples of activities that can be included. And then just to say that also for teachers, especially for their well-being, as I mentioned, it's important to identify additional learning needs, even for the children. And there's a technical guidance 3 that speaks to that. Again, as we have seen in many countries now, there are surges or increased numbers of infections, and this could lead to further or future school closures. So the guide gives us an opportunity to know what to do so that we prepare adequately for future school closures, having materials pre-positioned so that children continue to access this. Thank you. Next slide, please. Right, I'll also take us through what we need to do, especially in terms of child protection, mental health, and psychosocial support before the schools open. This is about preparation again of the teachers and education personnel, specifically around psychosocial and protection needs and how they can also manage their own well-being. So they are a support to the children, but their own needs also need to be met. So as a result, the guide is very particular on what needs to be done so that there's accessibility to local protection mechanisms. And again, the guide is very clear on, how we adapt those school-based reporting and referral mechanisms to the changing context, and ensuring that these referral mechanisms work. It's also about ensuring there's information access by the children and anyone who needs to report, and that this information is actually gender sensitive, inclusive, and age appropriate. It's also about working very closely with the caseworkers or social workers and looking at what exists in terms of those structures and ensuring that they are involved to support school reopening. After the schools reopen, the guidance is to ensure psychosocial support for children and young people, prioritizing girls and others who are most vulnerable. So there's a technical guidance but in a nutshell, this is where we look at those who are in high distress and those who have mental health conditions, and we aim to link them to specialized services. So it's about looking at what exists in structures, what we need to revamp, and ensuring we reduce stigmatization by delivering, age-appropriate, gender and inclusive, sensitive messaging to prevent violence, abuse, and bullying, or anything as a result of stigmatization. So so we can move to the next slide. Yeah. So this is the technical Annex 4, which is the mental health and psychosocial support for children as schools reopen. So as you can see, it gives a highlight on what needs to be done and what can be done by parents and caregivers, as well as what children and young people can do. So the guide is quite specific, and it's also giving access to activities in different languages and child-friendly stress busters as well. So it's about that reassurance of the children, preparing the children psychologically and the parents too, so everyone is aware what they're going through and what to anticipate in future. We can move to the next slide, please. Now the previous checklists, as I have presented, have been those that we as practitioners need to be aware of to support when planning to open schools, so before and even after schools are open. This particular checklist is for head teachers and school committees. And what the checklist is useful for is to give an idea of the school management and the head teacher on the key actions they need to be aware of. For instance, before the school opens, they need to know what I mean, do they have all their school reopening protocols in place? And do they, you know, have the guidance from the local Ministry of Education to reopen the schools in terms of have they received authorization? And we are aware that some of the schools have been used in some contexts as you know, quarantine facilities. So before schools reopen, then the school management needs to ensure cleaning is done and disinfection is done. Again, the whole element of personal protective equipment and prepositioning of this and wash facilities needs to be in place. And it's the role of this school management to do so. Messaging and child-friendly messaging, appropriate information on good practices in terms of what needs to be done by anyone accessing the school in these COVID seasons, and making illustrations that children can understand when communicating about physical distancing and just how to move within the schools. And in case the school was offering meals, again, there is guidance on what needs to be ensured in terms of the minimum standards. And then in the event that a child or a teacher or a personnel in the school has symptoms, then what happens? So again, this checklist is quite useful in that way, and for the school management and head teacher to prepare ahead of time. Thank you very much, and I'll hand over to the next presenter.
Thank you, Sally. Can we go to the next slide, please? Thank you. So I'm Sarah Dang from Save the Children, and I'm going to be presenting the Annex that was developed more recently to support early learning programs, any formal or informal program or ECCD center. And this Annex was developed to focus on 3 specific areas. One is the prevention of COVID-19 transmission, because with young children, they're less likely to cover sneezes and coughs, more likely to put their fingers and objects in their mouths. So we need to put in, we need to take special consideration for that group. They also need a small group learning environment, both to minimize the risk of transmission, but also to provide them with better quality early learning opportunities. And this can be challenging because we know that with ECCD, teachers are often, any qualified teachers are often taken into the primary grades. And given the urban-rural migration and all of the movement, and there might be an issue in terms of staffing. So that's an important consideration to keep in mind. And then the third consideration is the home learning environment. We know that with ECCD, parents really make a difference. If they can be engaged and if we can build their skills, they can really make a difference in terms of supporting young children's learning at home and also addressing the inequity that's also of concern to us in ECCD. So keeping those 3 dimensions in mind, we've developed a checklist that focuses on 3 groups, the ECCD center managers, the teachers, and the parents. So I'm not going to go through all of them, but I'll just highlight a few different areas. One is that the managers and administrators can put in place a variety of measures to reduce transmission. For example, by preparing the reopening plan with parents, discussing responsibilities, installing accessible hand washing stations that are at a lower level for young children, and screening children. In terms of the adult to child ratio, they can also find ways of being able to ensure this smaller child-adult ratio, for example, by having shifts or by having maybe alternating days, bringing in more teachers or assistants from the community and training them. But it's really, the key factor is that it's very important for us to have a small number of children per adult. And these groups of children shouldn't mix with one another. They can also consider increasing outdoor learning time because the risk of infection is lower outside, and we know that a lot of early learning activities can be done really well outside. Of course, we have to take into consideration the weather and any hazards, safety, etc. But that is something that we can creatively think about. We need to provide teachers with the training that they need, but also make sure that they don't feel that they need to catch up on literacy and numeracy as soon as the ELP opens. And we need to make sure that the staff are compensated for any additional hours that they might need to do. Next slide, please. The staff, so this is the teachers, they can organize the materials into kits that can be used by the small groups, and again, shouldn't be shared at the end of the shift or at the end of the day. They can be washed and then they could be provided to another group. They can make play and learning materials out of recycled materials. They can use leaves and branches. There's a lot of materials that they wouldn't need to wash. They could just throw if they took them from the natural environment. They also need to be able to recognize that the young children's behavior may be a bit different as they return, and they need to engage the families and also be able to identify caregivers in high distress and link them to mental health and psychosocial support services. And then in terms of parents, we need to make sure that they don't bring any unnecessary items from home, that only one person drops and picks up the children, and that they're able to support young children's learning and psychosocial well-being at home through parenting programs. Thanks, and I'll hand over to Frank for the Q&A.
Great, thank you so much, Sarah. And thanks to all the speakers for introducing the guidance and the different components or checklists. This guidance is interagency and cross-sectoral. So this meeting is also very cross-sectoral and people from different agencies. So it's a great opportunity to discuss reopening from this cross-sectoral and holistic point of view. Since we're a bit over time, we'll just have a very brief discussion now, maybe maximum 2 questions. But please continue to use the chat if you have any questions, and we can also answer in the chat. And also if you can indicate which checklist or presenter your question is addressing, including also Jim and Omar from the earlier presentation on the regional context. I don't see any new questions here. Okay, I see 2 questions. Well, I'll just cover those. First, Maha, on the gender perspective. Maha is the regional gender advisor for UNICEF. So I'm giving the floor to you, Maha.
Hi, Frank and June and Jim and colleagues. Thank you very much. You know, we're looking at the Brookings Institute suggestions in terms of reaching marginalized girls. And I think that both of the checklists offer us an opportunity to really strengthen the gender responsive dimensions of education. One of the things that I suggested was looking at the GBV user guide for circumstances where we may not have GBV specialists. We can also look at ways of working very collaboratively with our WASH colleagues where there are investments in improving sanitary facilities and increasing access to menstrual hygiene management supplies. So I'm just wondering, you know, how we can ensure that these are integrated in our checklists and become part of the way that we do business and as we build back better. Over to you.
Thanks, Maha. And opening the floor to the speakers. Anyone would like to respond to Maha's question and comment?
Hi, thanks, Maha. I'm Anton, WAS advisor for the children. Thank you for pointing a very important mention on the menstrual hygiene management for the girls. For sure that the together with the education, we have a WAS in school very closely investment program aside from the addressing all the COVID-19 related, and also doing an improvement of our continuity battling improvement of the school and WASH facility, especially for the allowing girls and adolescents to enjoying their learning even though during the menstruation period. So that's still ongoing battling, but I think we're on the track. Thank you.
Great, thank you so much. And maybe you'd also like to respond to another comment or any other speaker from Jonathan Valdez on WASH in schools, who also pointed out that aside from WASH, health and nutrition services in schools are also key in addressing challenges for girls. Would anyone like to respond to that comment?
Yeah, I think that's in line what I just mentioned about to addressing MAHA. So thank you, Jonathan. Yes. So this is I said this is an ongoing battling and is ongoing fighting. That's improvement of the how the every school that to ensuring they not just having chronic issue with a very lacking of a wash facility, especially with the COVID-19 pandemic, where the issue of the cross-contamination, as the fear of the school become the source of the infection when they are our students go back to the school. So that's the according to the checklist, back to the checklist, what we mentioned about it's very important for the all the key stakeholders, teachers, headmaster, all the PTA, parent association teachers, making sure that they're all well trained and then using the SOP. So having this checklist is quite an opportunity, and for so there's also room for improvement and adding for more features, and including strengthen the menstrual hygiene management for specific, I mean for the adolescent girls, and also for including the inclusiveness of the WASH facility to addressing the special needs for special students. Thank you.
Okay, thank you so much. I think in the interest of time, we will have to move on. But yeah, just to add that I think, as we've also seen in the discussions going on in the chat, that COVID-19 is also providing an opportunity for building back better in spite of all the challenges. And there's a lot of attention given to WASH, gender inclusiveness, and hopefully that momentum will continue as schools reopen and we can indeed improve the way things were compared to before. So moving on to the next third and final part of this webinar. And as mentioned, please continue going with the chat with your questions. We have 3 speakers covering 2 country examples, and they will look at how countries, the Ministry of Education, humanitarian agencies, and practitioners are preparing for the safe reopening of schools. We'll have therefore 3 presentations. The first speaker is Keshab Bhatta, who is a National Education Specialist for World Vision Nepal. We then have a presentation by Kalpana Aryal, who is Senior Technical Advisor for Disaster Risk Management for Plan International and will also cover Nepal. And finally, Mazina Jamil, who is a Program and Education Specialist in UNICEF Maldives. So over to you, Keshab, for the first presentation. Thank you.
Good afternoon, everyone. Sorry, there is slight it's me who is doing the first part of the presentation, and Kesab will be doing the second part of presentation because we prepared a joint presentation for World Vision Nepal and Plan International Nepal. Good afternoon, everyone again. This is Kalpana Aryal, working as a Senior Technical Advisor for Disaster Risk Management and Climate Change Adaptation with Plan International Nepal. And recently, in regard to COVID-19 response, I'm working as an Emergency Response Manager. In this presentation, we'll be covering mainly 4 parts. So one is general context of Nepal in regard to education, and Ministry of Education's preparation for the school reopening, and what Plan International Nepal and World Vision International Nepal are doing for the school reopening. And we'll be also covering the relevancy of this Safe Back to School guide in our context. Let me start with the general context. Lockdown has been lifted from 21st July in Nepal. However, there are some conditions such as a ban on large gatherings And as Jim has already mentioned, that school and there are nearly 9 million students affected by the lockdown, which went for around 4 months, more than 4 months. And out of the total 9 million students, 11% are from pre-primary level, 28% are from primary level, 39% are from secondary level, and 5% are tertiary level. And in Nepal, after this COVID-19 situation, the education system has changed dramatically with the distinctive rise of e-learning. It's basically through radio learning and TV learning, such kind of activities. However, there are many challenges around equitable access to e-learning. These challenges are among the people living in urban and rural versus those who are going to private school versus community schools or government schools, and it's among boys and girls as well. I want to highlight here, girls in particular might have lost out on accessing and using alternative learning resources, as there are negative stereotypes associated with girls using technology. And at the same time, it's not only due to stereotypes. It's when it comes to prioritization, then girls don't get prioritized by family if they have to choose among boys and girls. These type of things are putting girls on more risks. At the same time, if we look at the impact of secondary impact of COVID-19, the major impact will be on economic security, and there are various social factors that will put girls in risks. Let me give one example that is associated with child early and forced marriage. Family may take this as a coping strategy for them, and that will ultimately lead girls dropping out the schools. As of 30th June, 4,589 schools are used as quarantine centers, and 67 are actually as isolation centers. Though the number of quarantine centers is going down, it's reducing, and it's same for the isolation ward, and the number of people number of people staying in quarantine centers is also reducing. However, it may risk that government though officially announced that the school enrollment started on 17th, then it will risk school remaining closed beyond that official reopening date, because they need to align with quarantine periods, and they need to allow time for school disinfection. So there is still there may be gap on that part as well. Next slide, please. Now I'm going to what are the preparation from the ministry in regard to school reopening. Government has decided to start student enrollment from 17th August 2020, and local and provincial government are also doing preparation to reopen the schools. School reopening procedure framework with 17 school reopening checklist has been developed, and we have taken reference of this back safe to school guide while developing this reopening framework. And education sector contingency plan has been finalized, and it has been already implementing in the field. Textbooks for different grades are already developed, dispatched, and in some area it has been distributed, and in some area it's in the distribution process. Next slide, please. And in this slide, though these activities are not directly related to school reopening, these are the activities, foundation activities that will bridge the safe school reopening process, and this had been carried out during the lockdown period. Like guideline on facilitating students learning through alternative system 2020 has been endorsed by ministry. And guideline on early childhood development facilitators and teachers training are also endorsed. And self-learning material for ECD to grade 8 are developed, and the federal government has allocated budget to local level government for the printing of self-learning materials. Learning portal has been developed, and learning resources all are already like uploaded on that learning portal, so there is access to learning materials. Can we move to next? Now I'd like to hand over to Kesavji from World Vision International Nepal for the next two parts of the presentation. Thank you.
Okay, thank you, Kalparaji. I'm highlighting the few interventions which are made by the Plan International and the World Vision International Nepal. So, as a development partner, we have contributed to develop the school reopening guidelines. Similarly, we have been supporting radio school program from grade 8 to 4 to 10 for different grades and subjects. Similarly, we have distributed the self-learning materials that visit the school reopenings. These self-learning materials were developed by the Ministry of Education, Science, Technology, and the educational clusters. UNICEF Nepal has provided technical guidance, especially the Dipu Sakeji has very support during this this material development process. We are also working with the local to national level media partners to avoid awareness raising for parents and teachers. So we have also installed some the hand washing stations in schools in different districts. Similarly, awareness raising on back to school campaign through local radio, social media, and wall painting is ongoing. Thank you. Next slide, please. So, Plan Nepal supported local government Jumla and Kaligur district to develop education sector response plan for COVID-19. Similarly, Plan Nepal has developed education message in sign language and disseminated through TV, YouTube, and the social medias. Plan Nepal has been disseminating message on child early and forced marriage, as the families may use this as coping strategy that let goes dropping out of the school. So similarly, message on anti-discrimination that Plan Nepal is disseminating is expected to facilitate on children of migrant enrollment to schools. Likewise, the WBN supported on construction of golf and toilet with hand washing facilities in 7 districts. We are also planning for training to teachers on psychosocial counseling, stress management, appropriate use of teaching and learning materials. It will be the technology based. And we're also planning to support school disinfection, wash, and MHM facilities implement at school levels. So next slide, please. So relevance of the back to school guide in making school safe. Actually, the checklist for integrated and school friendly safe back to school, including technical and access, are included in back to school guide, which provided detailed guidance resources for specific activities like participatory English back to school campaign, MS, PSS, etc. So concept of engaging the whole school community is relevant in our context. So the guideline has adopted all hazards approach. This is essential for the multi-hazards prone countries like Nepal and monsoon. Local government, the Local Government Option Act has clearly defined the role of local governments in education sector. That would be easier to roll out the guide. So next slide, please. Yeah, similarly, the government has trained human source at Palika and province level for the effective implementation of these guidelines. The federal and the province government has the effective communication, especially the province and the federal level education cluster has been organizing the regular cluster meetings. So in Nepal, school and children as zone of peace in action. So it would be helpful to roll out this guide. The guide has been already used by plan to develop early recovery plans, back to school campaign, school disinfection, WAS, and MHM, firstly remedial class etc. So the guideline has been taken into reference to provide feedback to the government on school reopening guideline procedures. Okay, thank you. Here are some the glimpses of our program. Thank you. Hand over to Rachel.
Okay, thank you. Mazina, please go ahead.
Thank you, June. Thank you, everyone. Schools in the Maldives were closed in March, and therefore schooling and learning has been impacted in unprecedented ways. And next slide. COVID-19 has impacted approximately 100,000 students and 14,000 school staff and school staff, and approximately 9,000 to 10,000 teachers. In the Maldives, we have 213 government schools and 53 community schools and 8 private schools. And therefore, keeping all the schools closed for about 3 months had actually taken a big toll on the learning achievements and well-being of the children that had been achieved so far. Next slide, please. So therefore, to mitigate the impact of learning loss and on children and their well-being, UNICEF successfully advocated with the Ministry of Education and with the government to develop a comprehensive education response plan for COVID-19. And as a result, education sector is the only sector that has a comprehensive plan initially, because the response was seen only as a public health response, and therefore many other sectors were also were not involved in the planning of the health response. The main objectives of the education response plan is
Hi, Mazina. It seems that your mic might not be working or your internet connection is down. Can you hear us? Well, in the meantime, while we wait, I see a lively chat going on, so feel free to continue commenting and responding on the chat while we wait. Yeah, we can hear you again. Yeah.
Okay, thank you. Next slide, please. Right. So while planning for reopening of schools, UNICEF and the Ministry of Education contemplated on 2 scenarios. One scenario, which was about keeping the school closed until the COVID situation was under control, which was a big uncertainty because it never seems to be under control in any country. And scenario 2 was more acceptable to most of the stakeholders, which was about phased approach to school reopening with several measures taken before school reopened and after while schools are being prepared for reopening, and also after schools reopen. And the decision to go with scenario 2 was widely discussed with stakeholders, and of course keeping children and teachers' safety paramount in the decision making. Next, please. Yes, and therefore, with the schools actually reopened earlier than planned. Previously, it was planned to open in August. However, the pandemic seemed to be contained, and particularly, in the capital, Male, and we had a very strict lockdown for about 2 months, and therefore, transmission in other islands, community transmission in other islands was, controlled very well. As you know, Maldives is dependent on tourism, and therefore, the impact, the tourism sector had been hit hardest by the pandemic, and this also meant that the country was losing its revenues because the borders were closed, and all the economic activities basically had come to a halt. And therefore, it became quite a difficult discussion to hold with parents, with teachers, and with the government in general, because there was a lot of pushing and pulling from all different sides. It was easier to close schools, but it was harder to reopen schools. So it was decided that schools will reopen on 1st of July, despite all the resistance from the parents and particularly from the school community. The schools actually had put in place to institute interventions before reopening. As such, protocols for WASH and IPC and learning were developed. The Ministry of Education sent out ministerial circulars to all schools, requesting schools to implement the circulars, and also train the whole school community in implementing the protocols. Teachers were recalled to schools on 15th June to enable them to get oriented on the new protocols and also to prepare the schools with the implementation of the protocols. Additional hand washing stations were established in schools, and also visual signage for social distancing and other measures were also put up in schools. So schools really had a very short time to prepare for the reopening, and on 1st July, schools reopened for all the islands that did not have community transmission, which meant 80% of schools opened on 1st of July. But in those communities where community transmission was present, it was still continued to have community transmission. Schools reopened only for secondary grades from 9 to 12. Next slide, please. Next slide, please. Yes. And when the schools reopened, the necessary measures were put in place, and school principals and head of schools were made accountable to make sure that the protocols were implemented to the letter. Learning continued for 4 hours. Learning was arranged to be continued for 4 hours of face-to-face learning. However, the 4 hours was also meant that temperature checking, making sure children wash their hands twice during the session, and also orienting them on the new normal, meant that the actual amount of time spent for learning was not necessarily 4 hours. Therefore, to supplement the reduction in learning, the Ministry of Education also requested the schools to provide 3 hours of online learning or distance learning through televised lessons. And these lessons, the learning was basically conducted through a condensed curriculum. In the meantime, teachers were also trained on distance learning. All of this meant that teachers had to cope with a very huge workload. Physical distancing in the classroom was made possible only when the classroom size was halved, which meant that sometimes the same teacher had to teach in 2 shifts, adding to the workload of the teachers, in addition to the preparation for distance learning, and the actual conduction of the online classes. Next, please. Next slide, please. Yeah. Special emphasis and importance was given to well-being of students, because during the lockdown, there was an increase in child abuse and referral to the respective departments. And because of the lockdown, the response to the abuse cases was not satisfactory, and there was a huge community backlash demanding the government to take strict actions to protect children from abuse and exploitation. Therefore, schools were provided with special instructions on how to provide psychosocial support to students and teachers. And also UNICEF provided support to training of school staff on providing psychological support, basic psychological support, and also to identify signs of distress so that they can actually refer those students and teachers to professional help. UNICEF then engaged with the Ministry of Education on instituting online safety measures. And right now we're in the process of developing engagements with students, parents, and teachers on keeping themselves safe while they learn online. UNICEF, the education section, worked very closely with the child protection system to also, form the cross-sectoral linkages, and therefore the child protection system has been we've been supporting them with establishing stronger reporting procedures, building the capacity of social workers at the service centers, as well as working more with community-based organizations to provide COVID responses, particularly psychological support to students, teachers, and even parents. This also includes children with disabilities. UNICEF is working with 2 NGOs specifically to provide learning support as well as psychosocial support to children with disabilities. Next slide, please. And because, and with the easing of the lockdown, the easing of the lockdown coincided with the reopening of schools, which also meant that people, were really desperate to go back to their normal lives, which also meant that, adherence to the to physical distancing and wearing of masks, all of this was relaxed by some people. That meant a resurgence of new COVID infections, which actually caused the parents and teachers to resist going back to school. Also, any call to come back to school was also met with a lot of criticisms, harsh criticisms, particularly on social media. Therefore, UNICEF responded with a back to school campaign aiming to provide accurate information to parents, students, and teachers on the safety of schools, the new procedures put in place. And we also supported social media campaign with targeted messaging. We found that during the first 2 weeks, attendance was generally okay. However, with the with the rate of new infections going higher by the day, attendance kept dropping. And now, right now we are actually going into a long holiday, Eid holiday, which would usually, where usually people would travel. This time around, the government has issued strict instructions to go into a 14-day quarantine if anyone moves away from the island of origin, particularly if they move from an island where there is community transmission to an island where there is no community transmission. However, we are actually bracing for a very uncertain time once again. We do not know, the COVID situation after 2 weeks. Currently, the daily rate of infection is between 50 to 70 new cases. Next slide, please. So, things were not as easy, as I might have sounded. We face considerable challenges. As I said before, because the country is dependent on tourism, and tourism affected in a very, very bad way. Government revenues had gone down. We are experiencing a huge budget deficit, which also meant that public finances for the social sector have been slashed, including education. Now, the COVID response plan, as well as the safety protocols in the new normal, require a lot of funding. For example, even cleaning and sanitizing of schools 3 to 4 times a day requires a lot of funds. And currently there is uncertainty over whether these protocols can be sustainable, particularly those physical distancing and safe school protocols. There are approximately 55 schools that need proper wash infrastructure, but because of the reduced funding, we have not been able to, the government has not been able to provide the critical infrastructure. They are actually, they have temporary makeshift structures, which they currently find to be okay. However, I would like to point out that pre-existing inequities tend to be exacerbated due to COVID. Also, as UNICEF continues to mobilize funds, UNICEF also realized that the donor landscape has changed. Donor funding is dwindling, and therefore the possibility of actually mobilizing more funds to address the equity issues could become actually slimmer. We also had to face a lot of political influence to open up businesses, and this was the main reason why there was this constant backlash from the public, particularly from parents and school community, to reopen schools. But school reopening also meant that the community, the society is going back to normalcy. There's some sense of normalcy, and businesses can also open up, which also meant that parents can go back to work. Yeah, so right now we're actually bracing for a new wave of COVID infection, and we will have to really observe, the people, the movements, the behaviors, and the resultant, COVID situation, and then readjust the back to school plans. That's it from me. Over. Thank you.
Thank you so much. Thank you so much to the speakers, Kalpana, Kashab, and Mazina. We're still a bit over time, so please bear with us. Hopefully you're okay to stay on a bit longer. I think we're about 10 or 15 minutes over time. So we'll have a very, very quick Q&A before closing. And it's great to see all the comments and responses. I think I can just cover 2. I'll summarize one and open the floor for the other. So one comment was from Teo Soriano regarding the increase in online learning and the hazards that causes cyberbullying and so on. And yeah, just to summarize that issue, which is, indeed something we need to give more and more thought to now that, a lot of students are not online, but it's increasing every year. Now also given stimulus by the COVID context. There's also an initiative called GIGA, aiming to connect all schools in the world. So cyberbullying, identity theft, and also SRGBV, or school-related gender-based violence, that's something that really needs to be addressed. Now it's an important issue, not just to address gender-based violence in schools as we have so far, but also in online environments. So clearly awareness raising and trainings are really important, not just for students, but also for caregivers, teachers, and school principals. So that's something that we now have an opportunity to look at that as schools are reopening and building back better. Just one other comment, an important point raised by Jim Ackers, which is whether schools should reopen if minimum standards do not exist. Or if I may add, they may exist, but they're not being met by schools, such as many schools without wash facilities, as Purushottam from UNICEF Nepal has pointed out in the chat, and it's also the case in other countries. So what should these minimum standards be? And they may vary quite a bit from country to country. So for this one, I'll open the floor to the speakers from Nepal or Maldives, if anyone would like to respond on that minimum standards issues from their country perspective. So opening the floor, would Kapana or Kashyap, perhaps from the Nepal perspective? Or otherwise, Mazina?
Yes, thank you. I think minimum standards would become useful. For instance, in the Maldives situation, it's only government schools that have reopened, but the private schools and the community schools chose not to reopen. The government regulations cannot be imposed on the private and community schools. However, if we have minimum standards, internationally accepted minimum standards, then I think it could help us engage with community and private schools as well to resume schooling and learning. They are learning, but they haven't resumed schooling, with these standards adhered to. Over.
Frank?
Thank you. Yeah, Jim, please.
Yeah, maybe I should explain what I'm trying to say, because I've always been a great believer in minimum standards. But on the other hand, if we create protocols and so on that insist on certain minimum standards in terms of wash in school, and the school cannot meet those standards over the next 3 months or 6 months, those children might be out of school for that period of time. So what I'm essentially saying is that maybe we need to look at short-term pragmatic solutions, such as families or children bringing water to school in those environments, in order that those schools don't get left further behind. It's just one of these difficult tensions that we have in this response. Over.
Thank you, Jim. Any response from Nepal side, perhaps, Puru or one of the speakers? Or otherwise, Ivan,
Hi,
you raised it. Yeah.
Sorry, this is Anton again. I just want to echo Jim's point in terms of how we look at this minimum standard or guidance. If you look at the SPIR standard, even there's a process they have some windows of process to improve and to get into the minimum standard if we want to try our best. But however, if this not make it because of many challenges and the circumstances, that we need to do at least kind of one of the, we can say the mandatory that we need to be for example, I was in school, if we don't have our soap, maybe we look at the replacement. In absence of soap, maybe we can look at the ash. Or if the children, again, if they're really poor area, like in somewhere, they do not have access to water because they have a very drought area, or the village in the upper side where the water source in the lower side is not able to lifting the water, so means there's no water around. What we can do? I mean, there's always case by case, and I'm hoping, I agree with Jim that we need to look at what is the condition, and then we adapting into the context. I agree that sometimes using the minimum standard can make it more complicated. I think that the having standards as a guidance and reference, and however, back to the point where the practitioners in the field need to adapt into their situation. Thank you.
Frank?
Please go ahead. Yeah.
Yeah, no, I also agree with the proposal that there should be some flexibility as per the context. Definitely having minimum standard helps quite a lot, but one standard may not be possible to be like used everywhere. So we may need to look at like the size of the school, because some schools, for example, in Nepal, we have like 25, 30 or less than 100 children. So, and they may not have like adequate facilities there as well. So maybe that context differs from the school where you have like large number of like 2000 plus children and not having facilities. So I think we need to keep that in mind as well. And then maybe some flexibility, as well as the standards should be also as per like urban, rural size of the school. So that has to be like factored in as well, so that it helps. And as like Jim says, in some cases it may be like 3 or 4 months to establish the facilities if we wait for the minimum standard. So need to keep that in mind as well. Yeah.
Thank you so much, Purushottam. I've been given the signal that I need to close. See also the comment from Ivan on this, that there are huge areas where there are no wash facilities at all. We need to find some practical solutions. Schools do need to reopen at some point, taking into account also that schools should have some autonomy to find their own solutions depending on their context. So with that said, thank you so much for the comments. I hope we will continue the discussion somehow in some avenue. Over to you for closing, Rachel.
Thank you. Thank you, everyone, for your participation. Thanks to the country representatives for sharing your experiences. Again, before you go, I hope you were able to fill in the Google Sheet with your information so we can send the presentation and the link to the webinar recording. Thank you, everyone, and cheers. Bye.
Thank you. Thanks, everyone. And we'll share the PowerPoints and resources afterwards, as you have asked.
Thanks and bye.
Thank you.
Thanks, Frank. Thanks to
Thank you.
organizers.
Thank you.